Thank you. Dear colleagues, my name is Ida Bergman, and I'm a gynecologist at Södersjukhuset in Stockholm and a PhD student at Karolinska Institutet. And now I'm going to present to you one of our projects comparing surgical and conservative treatment in women with perineal defects. So if the anatomy after a second-degree perineal tear is not restored, the woman might later present to your outpatient clinic with these kind of findings. She has a short perineal body and an open vaginal introitus. And many of these women have a distal rectocele, since the rectovaginal fascia has lost its anchoring point in the perineum. Common complaints among these women are a sensation of a wide and open vagina, vaginal flatulence, sexual dysfunctions, and bowel emptying difficulties. So how do we help these women? Some women are referred to a physiotherapist to perform muscle exercises in order to improve agonist muscle functions. Some women are scheduled for surgery, aiming to restore the anatomy. But how effective are these two treatments in this group of patients? And which symptoms can the woman expect to improve? And are there any potential risks? We conducted a randomized trial aiming to answer some of these questions. We recruited 70 women with an improperly healed second-degree perineal tear, minimum 6 months postpartum. And at baseline, they filled in multiple validated questionnaires. We did POP-Q and ultrasound of the perineum. And then half were randomized into tutored physiotherapy and half into Colpoperineorrhaphy. And then we did a follow-up after 6 months, where we did the same assessment as at baseline, plus the women filled in the patient global impression of improvement, which is the primary outcome in this study. And this is a 7-grade scale where the woman rates her condition after a received treatment. And if she fills in very much better or much better, we consider it as a treatment success. So the results from this study show that the women in the surgical group had a 78% treatment success rate compared to only 11% in the physiotherapy group. And the surgical group improved significantly more regarding all secondary endpoints. For example, the pelvic floor distress inventory scores, the pelvic floor impact questionnaire scores, and also sexual functions improved more in the surgical group. And when we look at the dyspareunia, we saw a remarkable decrease in the rate of dyspareunia among the surgical group from 65 to 29%. So our main conclusion in this study was that surgical treatment is superior when we compare to pelvic floor muscle training in women with symptoms related to a perineal defect. And that surgery seems to do more good than harm, but must of course be balanced against the risks of surgical complications. Thank you.
Thank you very much. This paper is now open for questions. Maybe I could ask, firstly, these patients were 6 months following delivery?
Minimum 6 months, but median follow after delivery was 2.5 years.
So the short-term follow-up ones, were they breastfeeding?
No, that was an exclusion criteria. So regained menstruation and exclusion of breastfeeding was.
Elizabeth?
Sorry, I am only curious about how do you counsel this patient proposing to different treatment such as physiotherapy and surgery? Because I don't know how many patients decide not to enter in the study because they prefer to perform. I think it's better to perform a physiotherapy and then propose the surgery.
Because at least to our knowledge, there is no previous studies on this subject. We don't have any data to counsel the patient. That's why we performed the study. And
no, because I'm surprised because it's randomized. So
yeah,
I think that it's really difficult to randomize a group of patients for 2 different treatments such as yours. So just a curiosity, you know.
Yeah.
Thank you very much for your presentation. Interesting. I had a question. Were these women all delivered in your hospital?
No, I don't know the exact numbers about that, but no, not everybody. We have many different delivery hospitals in Stockholm.
Because it strikes me that about 70 women were randomized, and it seems to me that it's a common problem
Yes,
in
I
your
think
region, isn't it?
in our urogyn department, we perform about 50 of these every year.
Shouldn't there be more focus on primary prevention of this
Oh,
problem?
we have a lot of focus on that, believe me. We have big projects
But
on
still it happens.
Yes, but
So it's not
partly,
successful.
No, no.
It's
Yes,
it's a
I
work in
totally agree with
progress.
you. It's a big problem, and part of the problem is bad anatomical repair after the delivery, and partly also wound adhesions because of infection, so that the wound breaks down, and it's a problem.
Just to support Ida, we have similar problems in the UK as well, so it's not just Sweden.
Brecken from Norway. We have done a lot of science in the pelvic floor muscle training for urinary incontinence and prolapse. How many did have incontinence and prolapse? Because we have the cure rate of up to 77%. And how was the training performed?
Well, these women were not primarily incontinence or prolapse patients. The problem was more the defect perineum with the open vagina and air coming in and out, and so on. And they met.
A lot of them had.
This is the protocol for the physiotherapy. So they met a physiotherapist 1 to 3 times, and then they were they had a scheme where they a program to help them build up 10 maximal contractions, each 5 seconds long, 3 times per day, and 1 maximal contraction 30 to 60 seconds every day. So that was the program, and
Do you know if they were training? Do you have any adherence, compliance?
Well, we haven't measured the compliance, no. But this is kind of real life, how we do it in our clinic. So we didn't call them every day or have some kind of app or anything like that. No, no.
I think one final question.
Martina Erni, I just wonder, why did you wait 6 months to start?
Postpartum?
Yeah, but for the physio training, it's, I think, not appropriate.
Well, most of the women did physio training by themselves, as many women do postpartum, but we didn't interfere with that. They were just referred to our outpatient clinic because they had problems. And if they were minimum 6 months postpartum, they could be included in this study. And then they had tutored muscle therapy. They were randomized to that arm.
Lovely. Thank you very much.